Social determinants of health are a series of things out and about in society, things like education, economics, transportation, that we all know as part of our daily lives. But data has increasingly been showing is directly related to about 70% of what we would consider to be health outcomes. So the difference between how long somebody lives, the quality of their life, obesity, and diabetes can be directly attributed to things like education, where you live, access to healthy food, and certainly those are things that many community nonprofits and organizations are doing to impact day in and day out. It's probably not a surprise to anybody that Louisiana doesn't rank particularly well in overall health outcomes. We've been 50th or 49th for many years. And a lot of the reason why that is that we rank particularly poorly in both health outcomes and specifically the social determinants of health. Things like economic stability, neighborhood and physical environment, education, food access are all powerful determinants of whether somebody winds up with obesity and diabetes, which are key determinants of where we ultimately rank in those health rankings. So nonprofits really need to understand that the social determinants of health are a great way to communicate their impact to entities in the healthcare space. Nonprofits are daily working to improve educational outcomes, healthy eating outcomes, life outcomes for kids and families in a variety of different ways. And while they've communicated their impact in powerful ways historically, being able to articulate the ways in which what they do directly impacts the health and lives that folks show up in doctors' offices or folks show up in hospitals is a powerful way to communicate impact. It's also a powerful way to build new collaborators. One of the things we say regularly related to the social determinants of health is everything connects to everything else. And so while traditionally education and healthcare and transportation and economic development have been thought of as silos, these things all interrelate. And so when an education nonprofit or a health nonprofit can understand how they relate to each other, can partner together, they can find ways to much more powerfully serve their community and to have an even bigger impact. Education's a critical social determinant of health in a variety of ways. So at its highest level, education enables you to engage with your health. It enables you to be able to understand what a doctor's saying, to read prescriptions, all of those sorts of basic things. But then if we speak to specifically early childhood education, it has a couple impacts. So first, that early childhood set of experiences, particularly things like making sure that parents have the information they need to take care of very young children, or even prenatal care, can be really critical to making sure that a baby is born on time with the right birth weight and all those sorts of things, to making sure that a mom and a family has all the things they need for the very early days of a child coming home. And then if we fast forward a number of months more to do what we would consider to be early childhood education or care, having really high quality early childhood experiences is really powerful to make sure that kids are on the right health milestones, as well as the right educational milestones, as well as the fact that there's really high quality childcare enables parents to go to jobs, to pursue ongoing education themselves, to have more economic stability, to have more opportunities. So education, and particularly early childhood education, impacts kids, impacts parents, impacts families in a variety of ways that show up in the short run and for years and years to come.
You know that real rapid brain development happens between the ages of 0 to 3 years of age. So any experience that a child is exposed to is considered an early childhood experience. We have about 1 million neurons a second connecting. As we get older, we slow down in those neurons connect, and then we actually begin to prune them. So what experiences happen in those first 3 years lay the foundation for how a child is going to succeed in life, succeed in school. That brain development that's happening is going to impact their cognitive abilities, their language abilities, their social emotional skills, and we can do all kinds of things in early childhood to help promote that. Children are starting to learn well before they set foot into kindergarten. and that the interaction and stimulation they receive in the home or in a child care setting really helps to enhance their success in school. It's really around the bonds that they have with their parents or their caregivers. That's really where their first learning experience is. Those earliest relationships are very, very important to a child and have a direct effect on brain development, language, social skills, psychological health, and on the adult they're going to become. Research shows that we can predict a lot about their adult lives, their adult behavior, based on their experiences in early childhood. When children experience adverse experiences, it's going to impact them, it can impact them into adulthood. The research that was originally done looked at about 10 variables. So they looked at physical abuse, sexual abuse, emotional neglect, intimate partner violence. That means witnessing intimate partner violence. Their mother treated violently, substance use within the household, mental illness within the household, parental separation or divorce, and an incarcerated household member. And they found that the more of those events you had in your childhood, the more likely you were to struggle with mental health, the more likely you were to get involved with smoking or alcohol use, the more likely you were to suffer from obesity, the more likely you would have a shortened lifespan, depression, anxiety, heart problems, diabetes. It was related to physical and mental health. And we may not be able to control whether they experience some things, but we know that if a child has a secure, significant relationship, so with their parents, with another caregiver, that they are more likely to develop resilience to the impact of this negative event. I really urge nonprofits to consider those first 1,000 days of life, those first 3 years of life, and the whole environment of the child, on supporting the mother, supporting the early childhood educators, and really being there with the child, supporting their cognitive abilities, their brain development, their social emotional skills, their emotion regulation. When we do those things, we're really setting up the foundation for them to have a healthy trajectory and developmental life as they move on into childhood and into adulthood. If we can invest in that foundation now, we can invest in young children in those first 1,000 days, we can set them up for success. And it's going to be less expensive to do that now than to deal down the road with, substance abuse issues, smoking, early pregnancy, delinquency, and a lot of those obesity and a lot of health and mental health issues that we're going to see when we don't support those first 1,000.
HIPPY stands for Home Instruction for Parents as Preschool Youngsters. And it provides in-home, peer-to-peer counseling and support services for at-risk families and their parents to help parents help their children become successful in school. We need to address those conditions in neighborhoods and families and homes that actually influence health outcomes. We don't want to just increase access to services and medical care, but we want to also address early childhood and parenting and those things that are the determinants of healthcare outcomes. And as we confronted the lack of effective service delivery models for families that don't have access to traditional kind of bricks and mortar and facilities where they can drive up and make appointments with their caseworkers, we wanted to have something that was accessible. And so the in-home peer-to-peer counseling model has proven to not only be successful, but it's proven itself in HIPPY and in other similar programs to be effective in delivering positive outcomes for those families. The strength of HIPPY program is really the peer-to-peer counseling by people who have actually graduated from the program. So this isn't somebody coming from the outside of your community, it's somebody in your neighborhood who's coming to help you. And so our home visitors are really more like friends and family coaches than they are caseworkers. So our expansion developed as we previously had an in-home parenting support program and we saw its limitations. We wanted to be more effective. And so we turned to the HIPPY model. And at first we kind of eased into it. We started slowly, but as we had success, the families started wanting to sign up. And our capacity was far short of the demand that we have. We have a waiting list of about twice of what our capacity is. So we wanted to expand that.
HIPPY is necessary for effective childhood experience in the community I serve because, number one, we want the parent to be actively involved in their child's education. Number two, we know that HIPPY provides those protective factors. When a parent and child bond, it reduces the neglect and abuse rates. So in that, once that child has increased their education in those formative years, they're prepared to do better in school. You're a home visitor and I'm coming to your house. I would bring the HIPPY curriculum and a book. We would role play that curriculum, read the book. We would have the role play items. It could be a paper ball. It could be little pots. It could be a teapot. It could be a rope, a string. And I would role play that packet with the parent, exactly how she is to work that activity with her child. Our biggest thing is that the parent is the primary teacher of their child. So we want the parent to be involved actively in their child's education in those formative years when it's most important. And not only that, we help support the parent with various services of support, as in during case management, financial support if needed, or just basic services such as diapers and formula. Home visiting works because the home visitors are from the communities in which they serve, so they are peers. They know the people that they're serving and the community knows them. There's already a built-in trust. So when you go into the homes and you serve the families, they're more comfortable, because you're in their home. So right there, you can quickly address their family's need because you're already at that level of increased trust. We realized that we were serving isolated families and it was going to be increased isolation due to COVID. We quickly recognized the effectiveness of HIPPY and the platform of the home visiting model. So we utilized that to deliver all of our support and direct services, such as case management, finance support, and our childhood development education. Biggest challenge was trying to find ways to work with the families who don't have internet access. We are a rural parish, so a lot of our families don't have that. Even if they have the smartphones, they might not have the minutes. But the families who have internet access, we teleconference the curriculum. With the other families, we provided phone calls, extensive phone calls, to help them understand, because we're used to going into the home and doing one-on-one with the parent. So now we have to deliver the curriculum, then come back to the office, teleconference the parent, and do it, virtually. I'll read, and then the parent do what they have to do on their end. So it's different, but it's still an effective way of delivering the curriculum. With HIPPY, our retention rate is actually higher than the national retention rate. We have a 95% retention rate. Our parents are pretty involved and they love HIPPY.
The results tell us that the children are better prepared, ready to learn in school. The parents are more empowered to advocate for their children, and they're more engaged in their child's life. And finally, family resiliency is increased, and the likelihood of abuse and neglect are decreased. All of the children who participated in HIPPY have improved on their school readiness assessment scores, and the parents are spending more quality time with their children and more engaged in their child's life. Also, last but definitely not least, the Protective Factors Survey results show us that the parents are increasing the protective factors in the home. These are factors such as family functioning, social supports, concrete support, and nurturing and attachment. we are providing a very valuable service to the families who are in a geographically isolated area, as well as families that are typically underserved and in schools that are at times performing below average. One of the things that we really pride ourselves on is the fact that HIPPY is implemented by peers in the community, and the trust is already built in. So the families are already engaged and already invested in working the program and engaging with their child and making sure that they are their child's best and first teacher.
The social determinants of health are basically the social fabric that underpins someone. And what we've seen, particularly in these last number of months related to COVID-19, is all those issues that we knew to be true before that were playing themselves out when we looked at obesity or diabetes or access to healthy food, they've proved even more true today. We saw long lines at food banks. We saw gaps in people's ability to access digital healthcare, the gaps in people's ability to access digital education. Those were issues that were true far before COVID-19. COVID-19 has shown a light on those issues. And we know that many communities that were already struggling are struggling even more today, making it all the more important that we as communities, we as nonprofits find ways to support those in need and to address some of these underlying issues.
It's important that as organizations try to serve at-risk families and isolated families, especially during this COVID pandemic, when those isolated families are even more isolated by restrictions on travel and social distancing and the usual programs and services that are available for young children, we've got to be creative. We've got to make efforts to bring services to those families where they are in an accessible way and in an effective way. And so, don't be afraid to experiment. Find the people who understand that and find partners who are willing to support you. Also, I would say have patience. It takes some time to find the right people to be those in-home peer-to-peer counselors. It's not necessarily somebody who has a lot of intellectual understanding in schooling and learning and graduate degrees, but someone who has the same lived experiences and really has the same heart and motivation to help as our organization does and as those families need, and then lining up with a partner like Blue Cross has proven to be what's made us successful.